So now let's jump from here into post-104 week assessments and determinations as well as rebuttals. So we have a very kind of a similar, in a sense, schema when we're dealing with the question of a person being able to go back to an alternate form of work. You still have your physical, emotional, and cognitive impairments. On the physical side, instead of doing a more specific functional ability evaluation to determine whether a person can go back to this specific job, you can do a more general one that tells you how much a person can lift and stand and carry and bend and stoop and all those kinds of things. It can be generic, and with that generic profile, you can get a sense in terms of what occupations can be ruled in or ruled out physically. So we had the question in terms of where does the psychovocational fit in? So the psychovocational, in the context of any occupation or post-104 week determination, we need to look at a psychovocational assessment if it's a person with minimal cognitive impairment or a non-traumatic brain injury versus a neurovocational assessment for those folks who have traumatic brain injury, specifically organically ground cognitive impairments. And so with those two parameters, your psychovocational, neurovocational can give you certain occupations, and then when you map out the person's physical characteristics and limitations on that, then outspit some potential alternative jobs. And ultimately, that is where most IEs in the industry stop. They say, okay, you've done the psychovocational assessment, you've done an FAE, and these are the occupations that you can do. Well, first and foremost, has anybody noticed any changes in FAEs over the past couple of years that are done by insurers? Have you noticed any change in the quality of them? Any change in how they're performed? Anything like that?